Okay, can I interrupt you for a while?
Yes.
Well, the Sci Asia assistant, can you send the link to Dr. Abraham? He hasn't got the link yet.
Okay, you want me to send the link to Doctor?
Sorry, we're working on it. Sorry, Dr. Lim, we're working on it.
Thank you.
Okay.
Thank you.
Sorry for that. Please continue.
Oh, okay. It's okay. So the first target of neurotoxin that we know other than muscle is the sweat gland, right? Because the sweat gland use acetylcholine as well. So we used to inject the toxin to hyperhidrosis for the axilla or the palm and sole because it can reduce the sweat gland release by block the acetylcholine release at the cholinergic receptor. And go fast. The second is the sebaceous gland. The sebaceous gland, actually the mechanism of sebaceous gland inhibit the sebum production is unclear, but it has the evidence that it can reduce sebum production and also can improve the pore size.
About the technique, overall, the technique, the topical anesthesia, in my opinion, is it really necessary. Was applied 30 minutes before and before start procedure. Multiple intradermal injection of diluted delivered at around 0.5 to 1 centimeter using 30G or 32G needle. And the important thing is raising a tiny blunt bleb at each point. That is, we must have the tiny blunt bleb. This is crucial. Most patients needed around 1 milliliter or 20 unit each side. My patient the indication of the procedure for the patient, this is a large facial pore on oily skin and fine line.
So if you look through the study here that published 3 years ago by a group from Korea, they found a protective effect of neurotoxin against UV-induced skin pigmentation in the animal models. What they did is that they did in vitro study and in the animal study. For in vitro study that I show on the left side, you see that when melanocyte culture with UVB, you see a proliferation of melanocyte, this dendricity of melanocyte. And then on the lower left of the slide, you see that with the presence of neurotoxin, you see a less dendricity, less cell proliferation. So this is the data from in vitro study. And if you look on the right side, which is the data in animal, they did inject neurotoxin and then irradiate the skin with UVB. And then neurotoxin again, you see the lightening effect of the skin when compared to the area that treated with UVB alone. So we found that there was a decrease in skin pigmentation, decreased tyrosinase activity, decreased melanin content. So they conclude that the neurotoxin can suppress epidermal melanogenesis. Now let's take a look on the mechanism. They found that with this, the same study, they found that the melanogenic cytokine, especially basic fibroblast growth factor, interleukin-1 alpha, and prostaglandin E2, the level of these 3 parakine factors are decreased when compared to.
But the thing is that the melanogenic parakine factor already released from day after UVB, so it's quite difficult to stop the process unless you go with the fast onset action and high concentration, and you only see that in some patients only, not all patients. So I the role of treatment is not as good as the role of prevention.
Yeah. But it's just that it's just interesting to see that it can sort of stop in some patients.
In some only.
Yeah. So which I thought was a bit surprising because the cascade has already been going on, right?
Right.
Unless
the
it has a role of treatment.
release. So for the audience, I would not recommend to use these things on the treatment, because I think there are many other options that probably cheaper, like you do the laser or for reduced tanning instead of inject neurotoxin. But for prevention, there might be a potential.
What do you think